Once again, a precious human life has left this world. Someone who seemed perfectly healthy just yesterday is suddenly and irrevocably gone. Perhaps some readers are already experiencing something unusual in their own bodies, but are not paying attention to it. This refers to seemingly minor manifestations, such as digestive difficulties, recurring back pain, or unexplained fatigue. Throughout his 45 years of medical practice, this specialist has encountered countless patients. But one question has always remained the most agonizing for him, constantly voiced by those suffering. "Doctor, if I had sought help a little earlier, would there have been a chance for salvation?" The echoes of this desperate question still haunt him, reminding him of the tragedy of missed opportunities. Remarkably, over 7,000 people die from pancreatic cancer in South Korea each year. And, what is particularly concerning, over 90% of these patients are diagnosed only at a very advanced stage. However, there is no need to despair. In over 40 years of extensive clinical practice, this experienced specialist has uncovered a unique secret. He has identified 5 subtle but critically important warning signs sent by the pancreas. If a person is aware of these signs and can recognize them in time, there is a real chance to overcome the illness. This experienced physician, who has dedicated his entire professional career to gastroenterology, possesses a unique specialization in recognizing the earliest signs of pancreatic cancer, which, unfortunately, go unnoticed even by many other highly qualified specialists. And at this very moment, thousands of citizens across the country, unaware of the true cause, are experiencing alarming signals emanating from their pancreas. Alas, the vast majority tend to attribute these manifestations to natural age-related changes or common digestive disorders. It is agonizing for him to realize how people miss a precious chance to prevent a tragedy that could have been averted with just a little more attention to their bodies. Today, the specialist intends to share knowledge that cannot be found in standard medical textbooks. This information has been accumulated and hard-earned over many years of intensive medical practice. If anyone is inclined to consider this information trivial or even absurd, they are strongly advised to take the time and listen carefully until the very end. Otherwise, the consequences could be irreversible, and the opportunity to prevent disaster will be lost. The first of these key signals is an unexplained change in body temperature regulation. When there are problems with the pancreas, the body's natural thermoregulation processes are disrupted. Special attention should be paid to the combination of feeling cold in the extremities, hands and feet, with a simultaneous sensation of heat in the face. If such symptoms persist for more than 3 weeks, a comprehensive medical examination is immediately necessary. In conjunction with the other 4 signs, which will be discussed later, this knowledge will become a comprehensive guide for preserving one's life. The second signal is an unusual sensation of vibration or tremor in the abdominal area, occurring just before sleep. The third sign is a sudden and unexplained aversion to familiar food smells. The fourth indicates a noticeable change in the characteristic odor of sweat. And finally, the fifth signal manifests as unexplained stiffness or discomfort in the knee joints. If a person experiences 2 or more of these signs simultaneously, their life may be in serious danger. If anyone is inclined to believe that the information the specialist is about to reveal is common knowledge or insignificant facts, he strongly urges them to pay extreme attention. He emphasizes this again because the significance of this information cannot be overstated. Returning to the first of the mentioned signals, it is important to reiterate the disruption of body temperature balance. Often, people mistakenly believe that such manifestations are merely natural signs of age-related changes or a consequence of circulatory problems, not giving them due importance. However, over 4.5 decades of his professional activity, the specialist has identified a clear pattern. When the pancreas's function is disrupted, it inevitably affects the autonomic nervous system, causing significant dysfunctions in the body's thermoregulation processes. These symptoms are most pronounced between 10 o'clock in the evening and 2 o'clock in the morning, when there is a characteristic combination of icy extremities, hands and feet, with a simultaneous sensation of heat in the face and neck. If such manifestations occur at least 3 times a week and persist for more than a 3-week period, it is strongly recommended to seek qualified medical help immediately. Notably, such internal temperature fluctuations remain undetectable by a standard medical thermometer. Externally, body temperature may remain within normal limits, but potentially dangerous pathological processes are already developing internally. It should be recalled that the pancreas plays a key role in the synthesis of digestive enzymes and the maintenance of optimal blood glucose levels. When dysfunctions occur in its activity, there is a chaotic alternation of vasoconstriction and vasodilation, leading to impaired adequate blood supply to the extremities. As a result, sensations of cold in the hands and feet arise, while the central nervous system, attempting to compensate for this imbalance, causes overheating of the upper torso. Many people tend to explain these phenomena as natural age-related changes or consequences of stress, but over 85% of the specialist's patients who were subsequently diagnosed with pancreatic cancer experienced precisely this characteristic temperature imbalance. It is extremely important to note that this symptomatology has significant differences from the manifestations of menopause. There is no profuse sweating, characteristic of the climacteric period, but pronounced hot flashes are present. Furthermore, unlike problems associated with circulatory disorders, the application of warming procedures does not bring the desired relief. Such manifestations also bear no resemblance to heart diseases, as they do not involve tachycardia or shortness of breath. If a person experiences such symptoms, they should immediately begin systematically tracking their body temperature. It is recommended to measure temperature daily, at the same time, on the forehead and fingertips. Special attention should be paid to readings 2 to 3 hours after a meal. Such deviations can serve as an alarming signal of pancreatic dysfunction. If such manifestations have previously gone unnoticed, it is strongly recommended to start systematic monitoring today. The second most significant warning sign is a subtle vibration occurring in the abdominal area just before going to sleep. This symptom is among those that the vast majority of people tend to completely ignore. However, ignoring it now could mean irrevocably missing a unique opportunity for early diagnosis of a serious illness. Typically, people mistakenly interpret such vibration as normal intestinal peristalsis or a natural consequence of digestive processes. Nevertheless, the specialist's many years of observation convincingly demonstrate that when a tumor begins to develop in the pancreas, it exerts microscopic but constant pressure on adjacent blood vessels and nerve endings, provoking a specific vibrational pattern. This vibration is primarily felt in the area located slightly below the solar plexus, approximately 5 centimeters below the point where the lower ribs meet. While at rest and in silence, a person may feel something akin to a cell phone vibrating inside their abdomen. It is a subtle, irregular tremor. Typically, it lasts from 10 to 30 seconds, then temporarily disappears and resumes after 1 or 2 minutes. This phenomenon has absolutely nothing in common with normal intestinal peristaltic activity. On the contrary, when hungry, this vibration becomes particularly distinct and noticeable. A distinguishing feature of this vibration is that it does not cease when external pressure is applied to the abdominal area. If the cause were normal intestinal activity, light pressure would help reduce or stop the movement. However, when the source is the pancreas and its associated blood vessels, the vibration remains independent of external physical impact. The reason for this phenomenon lies in the fact that the developing tumor disrupts normal blood circulation, provoking unstable and turbulent blood flow within the vessels. This sensation is most clearly manifested 3 out of 4 hours after the evening meal, at which point the digestion process is complete and the intestines are in a state of relative rest. It is during this period that a person can most clearly and unambiguously detect this vibrational signal. Unfortunately, the vast majority of people tend to attribute such sensations to the effects of stress or ordinary physical fatigue. However, if such vibrations occur more than 4 times a week and persist for more than 2 weeks, it is strongly recommended to seek consultation with a qualified specialist as soon as possible. If a person notices an intensification of the vibration or an increase in its frequency, a visit to a medical facility should absolutely not be delayed. To detect this specific symptom as accurately as possible, It is recommended to lie down comfortably in a quiet, calm place. Then, take a deep breath, hold it for a few seconds, and fully concentrate your attention on the sensations in the lower abdomen. It is recommended to place your hands on the area located 5 centimeters below the solar plexus and listen carefully to the sensations for 5 minutes. It is quite possible that subtle changes will be noticed that previously went unnoticed. If, simultaneously with this specific vibration, a person also experiences a temperature imbalance, this is an extremely serious signal. The coincidence of such symptoms cannot be accidental. This is a clear and unambiguous warning emanating from one's own body. Perhaps some may consider this a repetition, but it is because these are matters of life and death. It must be spoken about again and again to convey the full importance of the information. The third alarming signal is a sudden aversion to the smell of food. Imagine a situation where food a person has loved throughout their life suddenly begins to cause revulsion. This is especially true for fatty dishes, meat products, and the smell of fish. Many tend to explain this phenomenon as a simple change in taste preferences or age-related characteristics. But the specialist has observed many cases where such a change was directly related to the condition of the pancreas. The pancreas is a vital organ responsible for producing digestive enzymes. When its function begins to fail, the body instinctively rejects foods that become difficult to digest. It is especially important to note that this aversion arises solely from the smell, even before a person tastes the food. The smell alone can cause nausea, urges to vomit, and sometimes even headache and dizziness. This is explained by the fact that hormonal changes occurring in the pancreas directly affect the olfactory center in the brain. When digestive function deteriorates, the body activates a self-protection mechanism, forcing the person to avoid potentially harmful food. This is particularly evident in the morning hours, when preparing breakfast. What previously seemed familiar and appetizing suddenly becomes unbearable. This specific reaction is not limited to 1 or 2 products. Initially, an aversion to fatty foods may arise. Then it gradually spreads to ordinary home-cooked meals. People often mistakenly interpret this as a manifestation of stress or depression. But the influence of the pancreas in such cases absolutely cannot be ruled out. If temperature imbalances or characteristic abdominal vibrations are added to the aversion to food, this is an extremely alarming signal. If such sensations persist for more than 2 weeks and are accompanied by unexplained weight loss, immediate medical attention is necessary. It is extremely important not to force oneself to eat. One should listen carefully to the signals of one's own body. The human body possesses amazing wisdom and is capable of warning in advance of developing illness. The fourth signal is a change in sweat odor. Perhaps this may seem absurd or insignificant to some, but the specialist strongly urges you to listen to the end. Body odor is not just a matter of personal hygiene. It is an important and informative indicator of overall health. When there are problems with the pancreas, the process of filtering toxins in the blood is disrupted, which in turn changes the chemical composition of sweat. An unusual odor appears, which can be sweet-sour, sometimes with distinct metallic notes. This occurs due to disorders in insulin production. With unstable blood sugar levels, the body begins to actively break down fat reserves, releasing a substance known as ketone. It is ketone that gives sweat that characteristic sweetish smell. What is even more important is that this specific odor is primarily noticed by others. Family members or loved ones begin to complain about an unusual smell emanating from the person and may even ask them to shower more often. This odor manifests even without significant physical exertion or exposure to high temperatures. It is constantly present, regardless of external conditions. And even after thorough washing, it reappears after a few hours. This is not a skin problem. It is a direct consequence of changes in the chemical composition of the blood. And no external hygienic procedures can eliminate this internal imbalance. The odor is especially strong on the back of the head, in the armpits, and between the toes, i.e., in areas where a large number of blood vessels and sweat glands are concentrated. Many tend to consider this a natural sign of aging. However, if body odor changes sharply, and especially if it acquires sweet-sour notes and persists for more than 2 weeks, This is a serious cause for concern. In combination with the other mentioned symptoms, this is a direct indication of the need for a blood test. It is essential to check the levels of sugar, ketones, and pancreatic enzymes. Do not hesitate to directly ask loved ones if they notice changes in body odor. Sometimes they are the ones who notice what the person themselves may overlook. The fifth and final alarming signal is an unusual sensation of stiffness in the knee joints. This symptom is among those that almost no one associates with pancreatic function. Typically, when knee pain occurs, the first thing that comes to mind is natural aging processes or the development of arthritis. However, when there are dysfunctions in the pancreas, inflammatory substances begin to spread through the bloodstream, reaching the joints, among other places. The knees, being among the largest joints in the human body, are among the first to react to such inflammatory processes. One patient, an 81-year-old man, had never complained of knee pain before, but suddenly, every morning, he began to wake up with a feeling as if his knees were frozen. Initially, he attributed this to weather changes, used pain patches, and did not give it due importance. However, over time, the symptoms intensified, and he was forced to see a doctor. A comprehensive examination revealed early-stage pancreatic cancer. The patient is currently undergoing successful treatment and shows positive recovery dynamics. Another patient, a 77-year-old woman, told a similar story. It became extremely difficult for her to climb stairs due to severe stiffness in her knees. For a long time, she mistakenly believed it was ordinary arthritis. But when other alarming symptoms appeared, she underwent a pancreatic examination and discovered the disease at an early stage. Thanks to timely diagnosis and treatment, her knee pain disappeared and her health was restored. Such stiffness has significant differences from the pain characteristic of arthritis. With arthritis, pain typically intensifies with movement, whereas with pancreatic problems, a sensation of stiffness can be present even at rest. This is especially pronounced in the mornings. After waking up, the knees feel as if they won't bend, and it takes 10 to 15 minutes to loosen up. The symptom manifests regardless of weather conditions, both in cold and sunny weather. A situation is particularly alarming if stiffness occurs simultaneously in both knees. In ordinary injuries, typically only one joint is affected, but with inflammation caused by pancreatic problems, both are affected. If this condition lasts for more than 2 weeks and is accompanied by other mentioned signals, it is necessary to immediately consult a qualified specialist. Perhaps some readers may consider this merely a hypothesis, but one should not forget, it is precisely careful observations that have become the foundation for progress in medicine. Now let's move on to the most important aspect. Which examinations truly allow for the detection of the disease at its earliest stage? Standard tests typically prescribed in medical institutions usually detect pancreatic cancer at fairly late stages. However, the early detection protocol developed by the specialist over 45 years of practice allows for the detection of even the smallest deviations. The first test strongly recommended is a specialized blood test. Standard tumor markers, such as CA19-9 or CEA, are certainly useful, but their informational value is insufficient for early diagnosis. The specialist recommends checking the levels of specific enzymes, elastase-1, chymotrypsin, as well as inflammation markers, C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR. These indicators allow for the detection of even initial pancreatic dysfunction. One patient, a 79-year-old man, underwent precisely such a test and was able to identify early changes that were not detected by other tests. As a result, a tiny tumor was found, and treatment was started at the very initial stage, which significantly increased the chances of successful recovery. The second important examination is endoscopic ultrasound, EUS. Ordinary ultrasound, unfortunately, does not allow for a sufficiently clear view of the pancreas structure. However, with the endoscopic variant, the device is brought significantly closer to the organ, which makes it possible to see even changes as small as 1 millimeter. For instance, a 74-year-old patient underwent such an EUS, and a 2-millimeter cyst was found, which is now under constant monitoring and examined every 6 months. The third is a special contrast-enhanced magnetic resonance imaging study, known as MRCP, magnetic resonance cholangiopancreatography. It allows for the visualization of the pancreatic ducts with the highest accuracy. Thanks to this examination, another 82-year-old patient was able to detect duct narrowing even before a tumor formed and promptly begin preventive treatment. If anyone thinks the specialist is repeating himself, it is because these are truly life-critical matters. And now, the specialist intends to share prevention methods that demonstrate real effectiveness and of which, unfortunately, almost no one is aware. The first thing to consider is strict control over water consumption at specific hours. The widespread belief in the need for an even distribution of water intake throughout the day is, in the specialist's opinion, erroneous. To maintain optimal pancreatic health, it is critically important to consume up to 40% of the total daily fluid intake between 6 and 8 a.m. This time is a period of maximum activity for the digestive enzymes produced by the pancreas, and the body has an acute need for sufficient fluid for optimal functioning. It is recommended to add a thin slice of lemon to warm water, as this helps maintain an optimal alkaline environment in the digestive system. As confirmation of the effectiveness of this approach, the specialist cites the example of a 70-year-old patient who, after just 1 year of regularly consuming 500 milliliters of warm water with lemon every morning at 7 a.m., noted a significant improvement in pancreatic enzyme levels. Conversely, after 9 p.m., the amount of fluid consumed must be sharply reduced. Late fluid intake, especially after 9 in the evening, forces the pancreas to continue active work at night, depriving it of necessary rest and recovery. The second effective method is a massage of a specific area located directly below the stomach, which should be performed 30 minutes before going to sleep. It is recommended to massage the area approximately 5 centimeters below the solar plexus, using circular clockwise motions with 4 fingers, applying moderate but noticeable pressure for 3 minutes. As an illustration of the effectiveness of this method, the specialist cites the case of a 60-year-old patient who, thanks to a 6-month course of regular massages, completely got rid of chronic dyspepsia. The third important aspect is mastering a special breathing technique. Instead of conventional deep breathing, it is recommended to learn and regularly practice what is called pancreatic breathing. Its algorithm includes inhaling through the nose for 4 seconds, followed by a 7-second breath hold, and then a slow exhale through the mouth for 8 seconds. This cycle should be repeated 10 times. This practice is particularly beneficial if performed 30 minutes before meals, as it significantly improves digestive processes. And finally, the most important thing the specialist wishes to convey to the audience: do not despair. A diagnosis of pancreatic cancer is not a final verdict, especially if the disease is detected at an early stage of development. More than 85% of the specialist patients whose disease was detected at an early stage were able to fully recover and return to a full life. From this moment on, everyone is encouraged to approach their own health with a completely new, heightened awareness and responsibility. The specialist wholeheartedly wishes readers good health and a long, happy life.